All right, let's get you ready for your exams. If you're studying for your boards, this is the fast track review you need. Today, we are absolutely mastering two huge topics: enteral nutrition and IV therapy. We're going to break down exactly what you need to know to walk into that test with confidence.
First things first, let's lock in the number one difference between these two. It's super simple. Enteral nutrition uses the gut, the GI tract. There's a famous saying, if the gut works, use it. On the other hand, IV therapy completely bypasses the gut. Everything goes straight into the bloodstream. Honestly, understanding this one core concept is the key to everything else we're about to cover.
Okay, let's dive into our first big topic, enteral nutrition. You'll probably hear it called tube feeding, and that's exactly what we're going to get into.
So what is it really? Well, enteral nutrition is just what it sounds like. We're delivering nutrients directly into the GI tract with a feeding tube. This is the go-to method when a patient's digestive system is working just fine, but for some reason, they just can't eat or drink the old-fashioned way.
So when would you actually see this being used? You can bet your exam will have questions on these scenarios. You got to think about a patient who physically can't chew or swallow, maybe because of severe dysphagia, or someone who's in a coma, or has a specific disease that makes normal eating totally impossible. For these people, enteral feeding isn't just a nice to have, it's literally a lifeline. Now, patient comfort is a huge deal here, and these are key safety points. Just because your patient isn't eating doesn't mean you can forget about their mouth. Oral hygiene every couple of hours is so important to prevent sores and nasty infections. If the tube goes through the nose, you've got to provide some gentle nasal care. And of course, keeping that insertion site clean and dry every single day is a must to prevent skin breakdown. These aren't just little details, they're absolutely essential. Okay, let's move on to the single most critical, most dangerous issue with tube feeding. This is a topic you have to know inside and out for your exam: preventing aspiration. So what even is aspiration? It's when that feeding formula, or maybe some stomach contents, goes down the wrong pipe and ends up in the lungs. And let me be clear, this is a huge deal. It's a serious and, yes, a potentially fatal complication. Knowing how to stop it before it starts is just non-negotiable. Luckily, preventing aspiration boils down to 3 really simple steps. Step 1, position. Get the head of that bed up, at least 30 to 45 degrees. Gravity is your best friend here. It helps make sure everything goes down, not up. Step 2, feed. You give the entire feeding while they're in that upright position. And step 3, maintain. You keep them elevated for at least a half hour, maybe up to an hour after the feeding is done. The golden rule you can never, ever forget: never feed a client who is lying flat. Ever. But what if you think it's already happening? You need to know these red flags like the back of your hand. Be on the lookout for any coughing, choking, or gagging, any sudden trouble breathing. Are you hearing gurgling sounds? Does their voice suddenly sound hoarse? Later on, you might see a fever, or they might complain of chest pain. You need to commit these signs to memory right now. And if you see any of those signs, there is only one first move. It's simple. Stop the feeding. Immediately. Don't hesitate. This is a medical emergency where every single second counts. Hit stop, and then get the nurse. Okay, time to switch gears completely. We're now moving to our second major topic: intravenous therapy. This is where we leave the digestive system behind entirely. The definition is pretty straightforward, right? IV therapy is just giving fluids, meds, blood, or even nutrients directly into a patient's vein. This is what we turn to when the GI tract isn't working, or maybe it just needs to rest. And IVs are a real workhorse. They're used for simple hydration when someone can't drink enough, for giving critical medications like antibiotics that need to get to work fast, for life-saving blood transfusions, and even for something called total parenteral nutrition, or TPN, which is complete nutrition given by IV when the gut can't be used at all. But just like with tube feeding, IV therapy has its own set of risks. So this next section, this is your must-know safety checklist. And trust me, it's packed with stuff you're going to see on your exam. This table right here is pure gold for your exam prep, so let's walk through it. First up, infiltration. That's when IV fluid leaks out of the vein and into the tissue around it. You'll see swelling, and the site will feel cool to the touch. Now contrast that with phlebitis. That's inflammation of the vein itself. So it's going to look red and it's going to feel warm. That difference, cool for infiltration, warm for phlebitis, I'm telling you, that's a classic test question. After that, just watch for the obvious signs of infection: redness, pus, maybe a fever, and of course, any active bleeding from the site. Okay, this brings us to our final and maybe most important section, your specific role in IV safety. You have to know what you're responsible for and, just as important, what you are not supposed to do.
This slide really sums up your entire job in 2 words: observe and report. You are the eyes and ears at the bedside. Your number one job is to observe for any of those complications we just talked about and report them to the nurse right away. Nobody expects you to fix the IV pump, but they are counting on you to spot the problems early.
I want you to burn this slide into your memory. This is non-negotiable. You never start IVs, you never change IV bags, you never mess with the flow rate, and you never change the dressing. These things are completely outside your scope of practice. They are the nurse's job, full stop. There are absolutely no exceptions. So let's wrap this all up with a final takeaway checklist for IV safety. You're going to be constantly observing that IV site. You're going to keep an eye on the bag to see if it's almost empty or if the fluid has stopped dripping. Any pump alarms, you report them to the nurse immediately. You're going to protect that line, make sure it doesn't get pulled or kinked, and maybe most important of all, if your client says they're in pain, you report it right away.
And that's our review. So to really lock this in for your exam, I've got one last question for you. Can you tell me the key difference in the signs you'd see between IV infiltration and phlebitis? Pause and think about it. If you can answer that, you are one big step closer to acing your test. Good luck.